Hello, I'm Dr. Johan Stipp and I'm a radiologist, and I'm here today to tell a bit more about CT scans and MRI as we use them for diagnosis of stroke and for treatment of stroke. The reason I'm telling you about this is that so that there can be more information out there for the families of patients maybe having a stroke, and so that people can feel more empowered about how to gain more information and knowledge about everything that's happening to them. So in general, there are two types of strokes. One is caused when there's a blockage in an artery and the blood cannot get past the artery. The other one is where there's bleeding from a blood vessel into the brain. In both instances, this causes a region of the brain that cannot get enough blood and thus not enough oxygen, and that area can die, giving us the symptoms of a stroke. One of the first special investigations the neurologist or the casualty doctor will order is a CT scan of the brain. So a CT scan is short for computer tomography, and that is a system that uses X-rays to image the brain. A CT scan is very sensitive for any blood in the brain. So if the cause of the stroke is bleeding from an artery, that will be very easily visualized on the CT scan. And treatment of that will be different from when a stroke occurs due to a blockage in an artery. Your referring doctor, either the neurologist or the casualty doctor, needs to know if a bleed has occurred in the brain or if it's just an obstruction, because the treatment of the two differs quite substantially. If the CT scan of the brain is normal, then the neurologist may order something that's called a perfusion CT scan. A perfusion scan looks at the blood supply in the brain, and if there is a region of the brain that is not being supplied as it should, and that can be the cause then of the stroke. An MRI shows up smaller regions of the brain that doesn't get enough blood, or other areas or other reasons why there may be a stroke. So, to put it all together, when a patient presents at an emergency department with symptoms of a stroke, the first test will be a CT scan of the brain to rule out the bleed. From there, your specialist or neurologist will decide what further testing must be done, either perfusion CT or an MRI. CT scans and MRIs are essential in the diagnosis and treatment of strokes, and by having more information surrounding this, it is hoped that families can have more understanding of the process that the patients go through and the doctor that is treating them. Thank you.